Okay. Um, there are medicines out there, such as Tamiflu and other things like that. Should we be taking these medicines if we think we have the swine flu?
No, and
Um,
it's very important not to, and there's a few reasons why. One of the reasons is there's a lot of Tamiflu out there, but there's not a lot of Tamiflu out there for everybody to take just because they have a common cold.
mhm.
So first of all, it doesn't treat that. And second of all, what we really need it for is for people who are sick. So if you are in the hospital, the only reason we're giving it to people is if they're really hospitalized and sick. It's also not a cure for the flu. It just sort of makes the flu a little bit easier on the body, so you don't become as sick. So it's not like an antibacterial where you have pneumonia, you take an antibiotic, now the pneumonia goes away because you took the antibiotic. This just sort of mitigates it so you don't get as sick. So that's first of all. Second of all, there's something called resistance. So if we take it and we have a very mild form of the flu, the next time we get the flu, it may not work because the virus actually changes, and it's not that it's smart, but it wants to survive. And one way for it to survive is that it gets this dose of Tamiflu or the Relenza or the other antiviral medications, and it realizes that it needs to make this adjustment to get beyond that and to keep growing and propagating and make people sick. So if we take it for a mild illness, there's more of a chance that we'll have resistant strains of the flu in the future, which we definitely don't want.
Okay. We've been seeing a lot of images, in the news and in the media. I mean, it's all over the place. It's been, the talk of TV for a while now, and so many images of people wearing face masks and things like that. Are these things that people, should be doing, or is this just kind of exacerbating a situation that's not so serious?
I think it's somewhat of an exaggeration. The problem in Mexico was that, they were still trying to uncover what was going on and how severe it was, and they had a lot of people who were sick with probably pneumonia or something like that, other respiratory infections, and they were attributing a lot of deaths and illnesses to the flu. Then most recently, they got all the tests back, and it turned out that most of them weren't in fact the flu. They tested negative for the flu, so they had, again, pneumonia or some other type of virus that wasn't this swine flu or H1N1 flu. So, in the situation where you're worried about a local outbreak, it's probably a good idea to wear masks so you can go about your daily routine or go about your business and not interrupt things to prevent the interruption as much as possible of regular business. So in the case of Mexico, it was probably smart to do that until they knew exactly what they were dealing with. Now, as of today or tomorrow, they're lifting all that. But again, you don't want to catch the flu. So it was a good idea in that situation. Up here, again, we're having some cases, very sporadic. As of today, they have 3 cases in Miami-Dade County that they're suspicious of, but they haven't confirmed it with the CDC. That may take another day or so. So in those cases, again, if you're coming in direct contact with somebody who does have the flu, you may want to wear a mask. But if people like firefighters and police officers and people who are coming in contact with people who are sick, who may have the flu and they're going to need further testing, it's a great idea to wear it. It's very important to wear it so that you don't get sick, because we don't know about these patients that haven't been tested yet. But for everyday everyday people just going about their normal daily routine, I wouldn't wear a mask. I think it's a little bit disruptive and scares most people.
Right.
If you are sick, then you might want to wear a mask.
Okay. So the bottom line is really just exercise, proper hygiene, things that people should be doing anyway.
Right. This is good for us because, we're sort of getting into a routine, especially with the hospitals and with the EMS, of, how do we prepare for something if there is an illness down the line or down, in the next few months or in years or something like that. It's really helping us get prepared for something big. Right now we have something that's interesting and it's something we have to study, but it's not making people sick, again. Mm-hmm. So which is great news, right? So it's helping us prepare, change our routines, but we should always be practicing good hygiene, washing our hands, using the alcohol wipes and stuff like that. So we are ready when there is something where, again, in the future, that may make people sicker. So, yeah, I'm not as worried about this as I am about something that may happen in the future. Worried about SARS and the bird flu, and none of those really panned out to be anything serious. Mm-hmm. So again, I think we're in the same situation now, but we should be prepared and have our mindset that something may happen in the future. So.
And how is the city of Coral Gables, what are they doing in specific to respond to the situation?
Well, we're meeting regularly. We're making sure that we have enough supplies, what we call personal protective equipment like gowns and masks and goggles, and that people are trained on how to recognize somebody who may be sick with the flu, and to take our own precautions to prevent it ourselves from getting sick and spreading it further. And we're working close communication with the Department of Health from the county and from the state, and with the CDC. We're getting updates regularly and giving those updates out to people that are appropriate. And again, really just getting everything ready in case people start getting sicker.
Okay. Definitely a situation that we'll all be monitoring closely.
Exactly. We're monitoring it. Right now, it seems like things are going on the downswing, so things are getting better at this point.
Dr. Grossman, thank you so much for coming
Thank
on
you.
and helping us explain this and inform the public. Thank you very much. And if you would like more information, the City of Coral Gables is providing you with many sources for you to stay informed. Remember to stay tuned to Coral Gables Television for any updates. Some valuable information regarding the swine flu is also available on Gables Radio 1620 AM and on the city's website at coralgables.com. In addition, the State Department of Health has created a recorded message with answers to frequently asked questions and current information. The message can be heard in English and Spanish by dialing 1-800-775-8039. Remember that this is no time for panic, and your best tools for staying healthy are staying informed, exercising proper hygiene, and using your own wise judgment. Doing that will help keep you and everyone in our Coral Gables community happy and healthy. I'm Leanne Morejon. Thank you so much for joining us.